Newcastle disease is a part of the luvavirus genus, which is a part of Paramyxoviridae. It is also known as avian paramyxovirus 1. It is the second biggest poultry killer after avian influenza. There are several genotypes due to the RNA polymerase, which allows point mutations. Between 1930s and 1970s, in the USA there was genotype 2, in Europe there was genotype 4, and in Australia there was genotype 3. And in the 1970s, genotype 2 disappeared and genotype 4 disappeared, but genotype 5 appeared in the UK. And after the 1990s, we have genotype 6, 7A, 7B, and 8. There are outbreaks in Italy and Germany. The F protein determines the virulence. It causes different enzymatic cleavage sites. The velogenic strain is the most virulent strain. The F protein cleaves any cell in the body, and there is a 100% mortality. It is visitropic, pneumotropic, and neurotropic. The mesogenic strain is milder. It can still cause neurological signs, as well as acute respiratory signs. The lentogenic strain is even more mild. It is used as a vaccine, but not in day-old chicks. And the apathogenic strain, the F protein only cleaves some cells in the GI, and it's used as a vaccine in day-old chicks. The disease has a horizontal infection only. There's no germinative infection. Galliform birds, like chickens and turkeys, are the most susceptible, and waterfowl are less susceptible. The virus is inhaled, and then it causes primary replication in the respiratory mucosa. Then it generalizes and spreads to all the other organs. So it can be visitropic and spread to the intestines, pneumotropic and spread to all the lungs, and neurotropic and spread to the brain and central nervous system. Clinical signs. For the respiratory signs, we can see conjunctivitis, sneezing, nasal discharge, and dyspnea, and tracheal rales. For the intestinal clinical signs, we can see whitish diarrhea. And for the central nervous system signs, we can see paralysis and tremors as well. In layers, there's also oviduct damage, and this kills the embryo and decreases egg production and causes a soft shell. In the pathology, we can see hemorrhages everywhere and an enlarged spleen, and we can also see swollen periorbitals and head and the lacrimal glands as well. In the brain, there will be encephalitis, and we can see cytoplasmic inclusion bodies. This is a notifiable disease, and there's also a minor zoonosis. To detect the virus, we can use PCR and hemaggglutinating and detect the virus through monoclonal antibodies. And to determine the virulence, we need to use a pathogenicity index. For the intracerebral pathogenicity index, it's done in day-old chicks, and if it's under 0.7, it's considered pathogenic. For the intravenous pathogenicity index, it's done in 6-week-old birds, and if it's under 1.2, it's considered pathogenic. For prevention, we use the different strains as live vaccines. The mesogenic strain is not used anymore, and the lentogenic strain is used but not in day-old chicks, and the apathogenic strain is used in day-old chicks. These are often applied in the drinking water. There are also inactivated vaccines,